Hello and welcome to my new channel where you and I discuss health. It's a great opportunity for me today to come and discuss health with you. My name is Dr. Manu, a medical doctor specialized in ophthalmology with a passion, great passion to see you well spiritually, mentally, psychologically, and of course, physically. Today, you and I will discuss the complications of diabetes because it is vital to you and I to understand these complications so that at least that can put a little bit of fear in you and I and an encouragement so that you and I will do battle to avoid this condition called the new pandemic of the 21st century. I name it diabetes. So, my friend, join me after the break so that you and I can discuss further. Thank you for coming back. As always, remember that all we discuss in this video are intended to be informative only. This is not a medical consultation, nor a personalized medical advice. For all medical advice, please do consult with your general practitioner. Now, without wasting time, let us zoom in our today's subject, diabetes complications. What are complications? Complications are negative effects experienced when a person is diagnosed with condition or even an illness. And there are a range of complications that may develop with diabetes. With that said, it is important to remember that not everyone with diabetes will exhibit all complications. However, understanding your diabetes status and severity, as well as following the advice of your medical practitioner, will lower your risk of developing complications. For diabetics, complications of prolonged excessive blood glucose levels can affect small blood vessels throughout the body, affecting all areas, including kidney, eyes, heart, and blood vessels, and even nerves. Retinopathy, nephropathy, and cardiovascular diseases are all complications that affect any of these organs of the body. Good control of blood glucose levels can help in reducing and minimizing the extent of the complications. Diabetes, serious health complications, including heart diseases, blindness, kidney failure, and lower extremity amputations. Though it can sound daunting when you are first diagnosed with diabetes, the good news is that most can be prevented through a combination of actions ranging from controlling the blood glucose through eating healthy, being physically active, work with your health provider to keep your blood pressure and cholesterol under control, and getting necessary streaming tests. Many of the complications of diabetes are much more likely to occur if you have high blood glucose levels or high blood pressure over a long period of time. Keeping both the blood glucose level and blood pressure at a healthy range is the best defense against developing any of the complications of diabetes. Now, let us mention few of the complications here. First, as an ophthalmologist, I will start with the eye problems. The eye problems, often called silent disease, diabetic eye damage. Why? Because the damage caused by diabetes can be happening for a significant long time before any change can become noticeable at all in the sight. Therefore, by the time a change is realized, the damage is often at an advanced stage and little can be done to change. Therefore, the best medical advice is to get your eye properly checked regularly or quickly quickly when you notice your vision is changing or deteriorating. High blood sugar is known to cause blurred vision. If poorly controlled, diabetes can lead to blindness. Eye damage caused by diabetes can be retinopathy, cataract, or glaucoma. People with diabetes have higher risk of developing eye problems like glaucoma and cataract. Another complication that can affect eyes is called retinopathy. The condition occurs when high levels of sugar in the blood cause damage to the retina's blood vessel. Most people with diabetes will develop some eye disease causing reduced vision or blindness. Consistently high level of blood glucose together with high blood pressure and high cholesterol are the main causes of retinopathy. The blood vessel can swell, leak fluid, or bleed, which often leads to vision changes or blindness. It usually affects both eyes. Should the condition get worse, more blood vessels will become blocked. Scar tissue build up in the eyes. The new blood vessel in the eyes have grown. This added extra pressure can cause the retina to tear or even detach. When left untreated, my friend, diabetes retinopathy in its most severe form can scar or damage your retina and result in complete loss of vision. As with most other conditions, these can be managed through regular eye checks and keeping glucose and lipid levels at or close to normal. Working with your doctor to monitor and manage your blood sugar levels regularly can lower your risk of this condition. Secondly, let's talk about foot problems. Diabetes neuropathy is a common complication of type 1 and type 2 diabetes caused by long high blood sugar levels. The condition usually develops slowly, sometimes over the course of several decades. Type 2 diabetes can increase the risk of severe complications that affect the feet. Diabetes can damage both the nerve and the blood vessels of the feet, leading to pain, numbness, burning pains and needles feelings, poor circulation, and possibly amputation. Nerve damage in the foot can probably lead to poor blood flow and loss of sensation of the pain. The most frequent descriptors that are experienced include numbness, tingling, burning, pins and needles, electric shock, and pain to cold. This means that the person will not be aware of any wounds that could occur in the foot. If the wound, cuts, or blisters of the foot are left untreated, they can develop serious infections that could be alleviated only by amputating the toe, foot, or leg. Most diabetics-related foot issues are caused by nerve damage, sometimes referred to as neuropathy. Addressing neuropathy in its early stages can help further complications. Keeping your blood sugar levels in a healthy range can reduce your risk of neuropathy. It may also help to exercise regularly and wear comfortable shoes. Now, let us see heart problems. Diabetes, especially in people with high blood pressure and high cholesterol, contribute to heart disease risk. It is widely known to the medical and care industry that heart disease is the top killer of people with diabetes. People diagnosed with type 2 diabetes tend to have higher level of cholesterol and blood pressure. People with diabetes face a greater risk of developing cardiovascular disease, with statistics showing that diabetics are roughly 5 times more likely to suffer in the future than those without diabetes. Also, patients with diabetes mellitus have over twice the risk of developing heart failure than patients without diabetes mellitus. High blood glucose levels over a long time can damage the lining of blood arterial walls and lead to the development of arteriosclerosis, impairing the blood flow. This can also be caused by a few other conditions commonly experienced by people with type 2 diabetes. A few of the common symptoms of heart disease include pain in the chest, shortness of breath, swelling of ankles, and irregular heartbeat. However, it is important to note that these symptoms could vary from individual to individual. Another complication of diabetes is kidney problems. The kidney comprises of millions of tiny filters, nephrons, which in turn have millions of tiny clusters of vessels within them. Blood is filtered inside the kidneys via the millions of tiny clusters of vessels. Consistently high blood glucose levels can interfere with the process of filtration of the blood or may damage clusters in the kidneys, causing kidney failure called nephropathy. High blood sugars, especially when combined with high blood pressure, causes kidney damage and lead to dialysis. A 2020 Kidney Research UK publication supports the prevalence of diabetic kidney disease and found that around 40% of people with diabetes could eventually develop diabetic kidney disease. The report further concluded that this is now the leading cause of kidney failure in the UK, with around 20% of people starting dialysis in the UK having the condition. Kidney disease in people with diabetes is caused by multiple factors, including diabetic changes in the kidney as well as vascular changes due to hypertension. Kidney disease caused by damage to small blood vessels in the kidney, leading to kidney becoming less efficient or to fail altogether. Kidney disease is much more common in people with diabetes than those without diabetes. Note that the common symptoms of kidney disease include fluid buildup, loss of sleep, weakness, nausea, and even in some cases, issue of concentration. These symptoms often do not occur until the kidney function is significantly impaired, which makes kidney disease difficult to detect. Maintaining near normal level of blood glucose and blood pressure can greatly reduce the risk of kidney disease. Another complication of diabetes is reproductive health problems. Diabetes can result in sexual and reproductive health problems, erectile dysfunction and impotence in men, semen flowing back into the bladder, inflammation of the head of penis, as well as yeast infections in women. Pregnant women with any type of diabetes risk several added complications if the condition is not monitored and managed. High blood glucose during pregnancy can result to the fetus gaining extra weight, which can result in additional problems in delivery, trauma to the child and mother, and a sudden drop in blood glucose for the child after birth. Fetus who are exposed for a long time to high blood glucose level in the womb are at higher risk of developing diabetes in the future. Another complication of diabetes is respiratory problems. Diabetes affects the overall quality of an individual's health and can contribute to the development of conditions such as pneumonia, tuberculosis, and chronic obstructive pulmonary disease. People with diabetes are more likely to die with pneumonia or influenza than people who do not have diabetes. When diabetes goes untreated, especially over a prolonged period, it can lead to occurrence of severe breathing difficulties in extreme temperatures associated with pneumonia. Despite popular perception and understanding and what many people may have been told, pneumonia is not caught because of cold weather. Instead, when diabetes goes untreated, it can lead to the occurrence of severe breathing difficulties in extreme temperature associated with pneumonia. Pneumonia in turn causes inflammation, which puts pressure on the lungs and makes it challenging to breathe. Another complication is stroke. Stroke is a condition which affects the blood supply to the brain, which can lead to permanent damage such as speech problems, paralysis, and sight issues. The risk factors of stroke are similar to the risk factor for heart problems. It has been well documented that people with diabetes have a higher risk of dying from heart disease and stroke than the general population. As diabetes results in a high level of sugar in the bloodstream, it damages the blood vessels. As a result, the blood vessels become clogged up as it is full of fat deposits. These changes can lead to a blood clot, which can travel to the brain and cause a stroke. There are so many complications of diabetes in the body: nerves complications, stomach complications, and so on. It is important for us to understand this. I trust that you and I, through this video, have come to identify some of the complications of diabetes and how these complications are dangerous, fatal to you and I when we have diabetes. Therefore, my friend, as usual, having the understanding of this complication, you and I must be armed with an holy anger to this pandemic of the 21st century called diabetes, and do everything that we can do in order to avoid having diabetes. This is Dr. Manu reminding you that your health will change when you begin to change what is in your plate. Peace. I love you. See you in the next video.